Okay, we'll start. So welcome everyone, good afternoon. A warm welcome from all of us here at HEAL to this webinar. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, an alliance of over 90 member organizations working for better health through a healthy environment. And it's my pleasure to welcome you to speak today about the health and mental health benefits of green spaces in cities. And I'm joined this afternoon by my colleagues Veronika and Jacek from a Polish office and Marianne and Elke from the Brussels office. It's wonderful to see so many of you interested in this topic for this afternoon. The importance of green spaces for our health is a topic in which we see growing attention and growing interest, both from policymakers, but also from the public. Green spaces in cities, parks, urban forest, or trees in the streets are beneficial to our health in many ways. They improve local air quality, they help to reduce noise, and they help to enrich biodiversity. They're also needed to keep urban areas cool, and I think this is something we'll see very much this summer with the heat waves projected and we're already experiencing, and they provide residents with opportunities to be physically active and engage with others. So they are beneficial and important in many ways. While everyone seems to agree that green spaces are important, there are very different views and positions on what should be done in order to increase the amount of green spaces in city and in order to help protect nature and these ecosystems, as they're also very much under threat. We see this clearly, these differing views, in what's currently happening at EU level, with unfortunately the Conservative Party and Manfred Weber trying to scrap a proposal for a law on nature restoration. This attempt to do away with this important proposal ignores the many benefits to our health from green spaces in urban and in rural areas. And it ignores also that a healthy nature is actually essential for our survival on this planet. It also ignores the call from over 3,300 scientists in support of nature restoration. In today's webinar, we want to present recent evidence and findings on the health benefits of green urban areas and discuss policy measures to green our cities. And I'm pleased that we have three distinguished speakers with us today to shed light on this topic. We have Dr. Mark Nieuwenhuijsen from IS Global, the Barcelona Institute for Global Health, which is an alliance between a foundation, academic institutions, and government bodies. We have Luk Bruyneel with us here this afternoon. He's from the Independent Health Insurance Fund, a not-for-profit health insurer in Belgium. And we also welcome this afternoon Dr. Marzena Cypryańska-Nezlek from the SWPS University in Warsaw, the University of Social Sciences and Humanities. Today is the third and final webinar in our series on the Healthy and Clean City of Tomorrow. And you can watch and listen again to the previous two webinars on the benefits of active mobility and also on the benefits of reducing NO2 pollution on HEAL's YouTube channel. With this webinar series, we also wanted to take a look especially at the situation on healthy and clean cities in Poland. And so I would like to give my colleague Veronika the floor for a quick welcome from her as well.
Dzień dobry, raz jeszcze witam.
Good afternoon. Once again, a very warm welcome to all of you. We are very happy to see you joining this webinar. As Anna said, green areas in the cities. This topic is of utmost importance in Poland too. When we create our cities, we have kind of forgotten, or we have expanded the activity zones. We have forgotten about access to nature and green areas, how important they are for physical and mental well-being and health. For years in Poland, we have seen this concrete cladding in the places that could have been managed otherwise. Therefore, our access to nature is limited. Average temperature in cities increases and we can feel the impact in our bodies. We have examples of revitalization failures, including the ones that were also supported with European Union funds. City squares, public use areas, common areas are turned into concrete frying pans. We've got lots of parking bays, roads are broader, and concrete is predominant in our cities. We would like us to remind ourselves how much we need the green areas. I'd like to focus on it during the webinar. As a matter of fact, without green areas, we are going to live in concrete deserts that are getting hotter and hotter, resultant from the climate change. I'd like to thank upfront our speakers for being a part of this webinar. And let me reverberate the fact that the previous webinars are also available on YouTube. You are more than welcome to watch the webinars. And now, over to Anna. Let me reverberate my words of thanks for your presence today.
Thank you, Veronica. Before we start, I would briefly like to present our housekeeping rules. So this is a webinar with simultaneous interpretation into English and Polish. And as we said before, please go to the bottom of your screen to check on the respective channel. It's unfortunately not possible for you to open your microphone and video camera to ask questions, but we do have a Q&A function where we invite you to ask your questions or provide any comments on the topics that you're hearing discussed this afternoon. And as I said earlier, there will be a discussion following the presentations. If you have any technical questions or encounter any technical problems, please contact my colleague Jacek for support. You can find him in the panelists list. And this webinar will be recorded and published afterwards on YouTube. And with this, I would like to give the floor to our first speaker. A warm welcome to Dr. Mark Nieuwenhuijsen, who will present to us about the health benefits of urban green spaces. The floor is yours.
Thanks so much, Anne, and great to be here. Hello to everyone else. I'm going to try to pull up my presentation. And can you see my presentation?
Yes, excellent. We can see it in presentation mode.
Excellent. Thanks so much. So I'll give a quick general introduction about green space and health, and also give a few examples on mental health, because I think this is a very important aspect of this. And now my presentation doesn't go forward. It's always a problem. I think I picked the wrong one. As you all know, I mean, we all love green space, I think. When we go into green space, we already feel better. I mean, that's normally case studies of one person. But I must say that also the science has improved a lot over the last 10, 15 years, showing real benefits of green space. But I would like to start off saying that, you know, it's not only green space that we experience in our cities, but also many other things. And what we've got to know over the last few years is that, you know, how we design our studies in terms of, you know, road network, or in terms of our park, etc., that determines how people use that space. Unfortunately, many of our cities are very car dominated. We put a lot of asphalt down. A lot of cars are going around the city, what cause a lot of air pollution, noise, heat island effect, stress, a reduction in social contact, and a reduction in physical activity that leads to morbidity and premature mortality. On the other side, that also leaves us not so much space for green space, so we don't see so much green space. And that's what is becoming clearer after this session, is that we need more green space, because it's much better for us than all these crazy cars just driving around the city and also causing heat island effects, what's a problem at the moment. So here you can see some of the benefits that also Anne mentioned about green space, what we see. Now there's fairly good evidence that it reduces cardiovascular disease and also cancers, that it reduces air pollution and noise, that it promotes physical activity. And I'll show you some examples how it actually improves also mental health in particular, and attention, and how it reduces the urban heat island effect, as what I said. Most over, I mean, we see that there is also a reduced premature mortality of people that actually live in green spaces. A few years ago, we did a review on green spaces and mental health benefits. Already then, there was quite a bit of literature around showing the benefits. The problem at times is that we don't know exactly what type of green space or how much green space was or is associated with better mental health. So these are some of the questions. Interestingly enough, we can actually measure the benefits of green space in the brain. I mean, this is a study done by Craig Bradman already 8 years ago, where he took subjects for a 90-minute walk in green space in an urban area and saw differences in the brain using functional fMRI. In particular, the areas where we normally see where people suffer a bit of depression in this pre-photo context, where you saw the benefits if people experience green space compared to if they were going just to an urban area. Also, they reported less rumination when they're actually going into green space compared to going into an urban area. So, I mean, it's, this effects you can directly see. And what we also know that there are much more longer term effects. I would like to mention this particular study among school children. School children, the children are our future generation. This is a study conducted here by colleagues here in Barcelona, where they looked at 2,500 school kids. And they divided them by going to a school with a lot of green space and the schools without much green space. And then they followed them up. They looked at their cognitive development by measuring working memory and superior working memory. And they found that the kids with a lot of green space around the school were doing much better in terms of superior working memory or working memory than the kids that went to what I would call gray school. So, in this they can carry with them for the rest of their life. So that's why it's also important to think about kids when we're thinking about green space. This is a systematic review we did a few years ago, looking at cohort studies where they looked at green space and premature mortality. And we saw that there was a clear reduction of premature mortality of people living in greener areas. And this was fairly consistent across the studies. What is important, to show that you can get the benefits in different parts of the world. So recently we conducted a health impact assessment in 1,000 European cities. This is part of the UBD policy project that we're conducting. We focused on data from 2015. And in these 1,000 cities, we looked at how much green space is available to people. And if we would increase the green space, how many premature deaths could we avoid each year? What we found was that if we would achieve the WHO recommendations in the city, in these particular cities, that is, people need to live within 300 meters of a green space of at least 1 hectare, then we could prevent 43,000 deaths per year if we would green the cities up to this level. In general, we found that 60% of the population did not have sufficient access to green space. Often, cities say that they're green, but actually the green space is not close to where people live. It's more on the outskirts, so people don't benefit from the green space as much. Also, we tend to see that in poor areas, there is not as much green space as there is in richer areas. So this study took into account where was the green space in these particular cities, who was exposed to this green space. So that's an important aspect of the study. Some of the studies where we found the highest premature mortality rate are given here. I mean, perhaps it comes to you a little bit of as a surprise, but top of the ranking was Brussels, followed by Copenhagen. Now, Copenhagen has a lot of blue space, a lot of sea, and that was not included in this analysis. Explains something like that, what we see here. But you see the cities, and in all of them, more green space could prevent premature deaths. We've got a website, isglobalranking.org. There's data on the 1,000 cities. You can key in your city and then see what is the green space level in the city and related mortality if there's not enough green space. And there is also data on air pollution and noise. Now, recently, an urban forester, Professor Cecil Konijnendijk, he proposed a new, what he called a green space rule for cities. He said that every citizen in the city should be able to see 3 trees from their window, live in an area with 30% tree cover, and live within 300 meters of a sufficiently sized park. So he referred to this as the 330-300 rule, which is fairly easy to remember. We looked in Barcelona how many people achieved this rule, and we found that only 6% of people actually achieved this green space rule, partly because, you know, Barcelona is very compact. There's not much space for green space. There are a lot of cars around, unfortunately, so there's a lot of improvements to be made. We found, however, though, that people that achieved this rule, they were between 20 and 80% less likely to report poor mental health indicators like poor mental health, or use medication for anxiety or depression, or go to a psychologist or a psychiatrist to attend to their problems. Another development, what we see here in Barcelona, is the so-called greening of streets, or making green corridors. These are referred to as the ejes verdes, the green corridors. The idea is to make 1 out of every 3 streets, make them greener, and also pacify them for motorized traffic, so only allow active transportation to go through there. And this is what you see. This is one area in Barcelona, right in the middle, the so-called example area, is where you can see the streets that are supposed to be greened, and then the rest of the streets what are left normal. Unfortunately, not all these streets are greened yet. Only 4 out of them, Consell de Gen, Girona, Comte Borel, are some of them, I mean, that are greened, and we're waiting for the other ones to be greened as well. Anyway, we did a health impact assessment where we looked at if this full plan would be implemented of greening streets, making these green corridors, how many cases of poor mental health and mental health problems could we actually avoid in the city. So here you can see an example. One of the streets, this is Roquefort, I think, what it is, where we see on the top left what it was before, and then on the other pictures, you know, what it looks like afterwards. These are actually drawings. These are not the real pictures yet, but this is more or less how it's going to look like. What we found was that if they would be implementing these green corridors, these ejes verdes in throughout the whole city, we could reduce 14% of cases of self-perceived mental health problems. We could reduce 13% the number of visits to mental health professions, 13% reduction in antidepressant use, and also an 8% reduction in tranquilizer use. So this would be a direct saving of around 45 million per year as a result of this. So if we look at actual numbers, we see that we could prevent more than 30,000 cases of poor mental health and nearly 10,000 cases of tranquilizer use. So, you know, these are fairly large numbers. Actually, you could reduce or could improve people's health if you would apply more greening to the city. Finally, what we're seeing is that, in particular in Europe, we're suffering of hotter and hotter weather. We know already that our cities, the city centers, are warmer than surrounding areas, the so-called urban heat island effects. You know, and with the warming and with the urban heat island effect, it becomes almost unbearable. I mean, particularly if I look now in Barcelona, it's pretty hot. You know, this urban heat island effect comes because there's a lot of concrete, a lot of asphalt in the cities that absorbs the heat, traps it, and then releases during the night, what makes it particularly unpleasant during the night. What we showed in our study of 100 cities was that over 4% of summer mortality is due to the urban heat island effects. But also that if you would increase tree coverage in the 100 cities that we looked at to 30%, you could reduce the temperature by over 1 degree and prevent about a third of these premature deaths that are attributable to urban heat island effects. At the moment, the tree cover in the cities, in these 100 cities we looked at, is around 15%. So it would mean a kind of doubling of the tree cover to prevent a third of the premature deaths due to urban heat island effect, what is quite considerable. Now, people always ask me, can you actually make changes? And I think, you know, you can show some examples that actually show are the strongest, I think, for showing what actually can be done. And here you can see, for example, in Seoul, where they had a motorway before, they took away the motorway, put in some blue spaces, a river, a canal, more some green space, and reduce car use, so a much nicer environment. This is the Alderley Hospital in Liverpool. On the left side, you see the old hospital with a park next to it. And then they asked the children, what would you like? And they said, we want more park space and still a nice hospital. So they built a new hospital where the park was before, covered the top with grass, etc. And then the old hospital became a park. So you can see much more park space and a new hospital. This is one of my favorite streets in Barcelona. It's Rambla de Poblenou. This is a pedestrian street with cycling lanes on the side and a lot of trees. I mean, and it's actually so much more comfortable in the summer to walk around on these streets than surrounding streets, you know, where the temperature can be 5-10 degrees higher than we actually experience on this particular one. Of course, I'm coming from a public health background, and I can't do much, I can't change much. And that's why we need to work together with other professionals, I mean, including urban planners, transport planners, but also urban foresters, the green management people in the city councils, but also housing, you know, and also education, because in particular, I think there is some gains to be made by greening school yards, for example. We see often that they put just a lot of concrete down or whatever they have. I mean, what are not very nice and they're very hot. And in particular, these are the type of spaces you can actually green and make much more comfortable. That. Just one advertising, we just started a new project. HEAL is also in there. It's called the UBD Policy Project, where we are going to explore some of these issues. We're going to look at a number of different cities, where we're going to look at new scenarios for greening cities and what will be the health benefits of this. And also we're expanding our health impact assessment in the 1,000 cities for the coming years to keep tracking if we're making any progress there. That finally here, this is a very nice paper coming from a workshop where you can read a lot about what's going on about greening and health benefits, and also the different mechanisms through which we actually see the benefits in our cities. That. For this, I'll leave it. Thank you so much. Happy to take comments, or perhaps we need to leave it till the discussion at the end. I don't know how you're doing for time.
Indeed. Thank you very much, Mark, for this excellent kickoff into into our discussion webinar today and presenting this wealth of information. I'm really glad we're recording this webinar so that we can all go back and look at the many points and evidence that you mentioned. And that's definitely worth highlighting, that there is there is a wealth of evidence out there that we can draw on, and it's also very good to see the clear benefits emerging. Indeed, we want to come back to the discussion at the end. I think there are definitely lots of points there on what to follow up on. We don't have any questions yet, so I'm inviting you to everyone in the webinar to share your questions or comments in the Q&A. And we're now staying in the realm of the benefits of green spaces, the health benefits, and also the cost savings we would get by improving our greening in urban environments. And turning over to Luk Bruyneel, he's from the Independent Health Insurance Funds, and he will present to us a study and analysis that you have carried out on the number of doctor's visits avoided. Luk, over to you.
Yes, very nice afternoon, everyone. Do you hear me?
Yes, we can hear you well.
Yes.
That works. Great. And we can see your slides.
Yeah, I'm having a little bit of trouble sharing the whole screen. Let me start again.
Okay. Yes, now we can see your presentation mode. Excellent. Okay.
Okay. Well, first of all, many thanks to the previous speaker for the excellent presentation. It was really inspiring, and it also helps me in not having to repeat some things that were also mentioned in my slides. And so what I think I will do is to add another piece of the puzzle about the association between air pollution, green space, and health. So my name is Luk Bruyneel. I work at the Independent Health Insurance Funds. I'm doing research both at the Independent Health Insurance Funds, but also at KU Leuven, University of Leuven in Belgium. So this study originated within the Independent Health Insurance Funds. And very briefly, who are we? We are actually three health insurance funds, Heelan, Partenamut, and de Vrije Krankenkasse in Belgium. And we represent about 1/5 of the Belgian population. We act in various regional and national commissions to maintain, the durability of the healthcare system. We also act as a knowledge center. We perform studies and analysis on all the data that we collect from the members of our health insurance funds. And we also develop tools, IT tools for the health insurance funds, as well as for the members to provide them with all sorts of information. So in our priorities, there's a lot of stuff going on. We are looking at working capacity medicines, but also since, let's say, 5 years, we are looking into the association between what's happening around us in the environment and consequences for our health. And actually last year, this translated into a first study that was published in Environment International, which is a quite important journal within this domain. And it was about the association between air pollution and mental health. So actually we showed, using a case crossover study, that on days with high levels of air pollution, we saw that more people are getting sick and not coming to work. It's actually one of the few studies that is showing such relationship, which was evidenced in a recent systematic review and meta-analysis on this topic. After that, we started wondering, what did we miss? Which other variables are also important? And that's how we added green space into our focus. And so, of course, as Mark has highlighted, there is a lot of evidence on air pollution, especially particulate matter 2.5, on the many effects it has on both mental and somatic, all kind of negative outcomes, but also for green space, as Mark has shown, there's a lot of evidence already, both on mental and somatic health. So what we see is that green space has a quite important role, and I wish to reiterate it. it depends on the type of model that you look at, but this is from Markiewicz. It's a quite important landmark study, which showed that green space influences our health and well-being in 3 ways: by reducing harm, for example, from particulate matter, by restoring capacities, attention restoration, for example, and also by building capacities, which was quite prominent from the slides that Mark has shown also. So also in Belgium, there is previous evidence on an association between air pollution, green space, and various health outcomes, but mostly quantified in terms of medication sales. For example, one study showed that forest cover was associated with a decreased number of cardiovascular medication sales. And from the same authors, there was also a study later that year that showed that grassland and garden cover were associated with increased childhood asthma medication sales, but no observations were found for forest cover. So there are quite ambiguous relationships, and we believe that most of these studies are limited by the fact that they use aggregated outcomes. So they use outcomes at a nationwide level. So as insurance funds in Belgium, we collect all our data nationwide, but we don't provide to external researchers the data at a personal level because of GDPR issues. Now, when we look at the data within our independent health insurance funds, of course, we can use these data at an individual level, which is a huge benefit for conducting research. And that's exactly what we did here. So we looked at the association between particulate matter, tree cover, and grass cover, and how they influence non-urgent and urgent medical care utilization. And we studied both young people and adults using our immense data set. So what we also did, and that's quite novel, is that we estimated from this the potentially avoidable costs, and we looked particularly at the effects of particulate matter on GP visits. So we have 3 main predictors, which is air pollution quantified by particulate matter. We have tree cover and grass cover, and then we have multiple outcomes for healthcare utilization, and I will mention them in a few minutes. So we looked at our members in the year 2019 who live in Belgium and who have been living at the same census tract, which is the lowest level, geographical level you can look at in Belgium using statistical data. And so they had to live at the same census tract throughout the whole study period. So as you can see, we use data from more than 1 million people, more specifically, more than 300,000 young people, and almost 900,000 adults. So the average age of these young people was 16.7 years, while in adults it was 45.3 years, and the genders are quite balanced in terms of female and male study participants. So we used 3 outcomes, and we can quantify these outcomes. So as health insurance funds, we have data available on a very detailed level using nomenclature data, it's called. And it allows us, and we are not alone in that, and that is also important to mention. I think this research can be replicated in many other countries. So we use data to quantify the number of in-hour GP visits per person, out-of-hours GP visits per person, and also hospital emergency room visits. So in-hours GP visits, it means that we can quantify whether a person on a specific day had a GP visit and whether it was in regular hours or whether it was out of hours, meaning during the weekend, during the night, etc. So a special type of GP visit. As predictors, we used particulate matter, and as you can see, Belgium is quite problematic in terms of particulate matter. So we categorize particulate matter. These are the annual averages into 4 categories. And I can't see the below categories because there is a thing from Zoom in front of it. But what you actually can see is that, it's mostly a problem in the northern part of Belgium, in Flanders, where we have whole areas, whole arrondissements, where the average level of particulate matter is very, very high. So I think what WHO wants is a threshold of 5, and almost none of the statistical sectors, which are 18,000 little geographical levels in Belgium, adhere to that guideline currently. So it will be a huge challenge to get there. And also, yeah, if you look at Brussels, it's in the south. There is kind of an area where it's better, but overall, Brussels is also a very problematic region. Now, when you look at tree cover and grass cover, our other two predictors, and you think back about what Mark said about the 330-300 rule, well, then you can see here, if you look at the legend, the darkest regions are regions where it is where there is more than 30% tree cover. Well, again, if you look at some areas of Belgium, it's absolutely not the case. So there are areas in Belgium where it's 0% or 2 or 3%. So very, very low. So we extracted these data from Copernicus Land Monitoring Service. And the most recent data available at that time of the study was 2018. So, of course, when we want to model these associations between air pollution, green space, and outcomes, we need to adjust for some confounders like age, gender, but also at the level of that census tract, we corrected for various socioeconomic factors. And of course, we also conducted urban-rural stratification analysis to see if the effects are consistent both in urban and rural areas. So when you look at the massive amount of data that we have, so for almost 1 million of our members, well, you can see that they consume a lot of healthcare annually. So the average number of in-hour GP visits for adults is 3.29. So we have almost 3 million GP visits for our 880,000 adults in 1 year. So it's massive. And also for young people, it's a little bit lower, but it's still quite high number. So, of course, there's a whole lot of statistics going on, but it's not the main focus of today. So let's look at the findings, and what we see is that particulate matter, so that our measure of air pollution, is very highly associated with the number of in-hours GP visits, meaning that the higher the level of air pollution, the higher the number of in-hour GP visits. What we also see is that the higher the tree cover, the lower the number of in-hour GP visits. We see that association both in young people and adults, and we see that it is mostly consistent in urban areas. We also see some other associations, especially with out-of-hours GP visits, but the most pronounced associations we see for the regular type of GP visits. For grass cover, there are very limited associations from our statistical models, and this corresponds with previous scientific literature. But so, to put it very briefly, air pollution and tree cover are huge predictors of healthcare utilization in Belgium. And so when we look at what does it mean in terms of euros, then we try to quantify it, of course, assuming causality, which you can always challenge, but it's kind of an exercise to estimate the costs associated with air pollution, with limited green space, like Mark previously did. Well, then we saw that on an annual basis, and in terms of direct costs, meaning looking at doctor visits alone, we can prevent about 5 million euros annually. So from the side of compulsory insurance, but also from the patient side, who pays out-of-pocket payments when he visits the doctor, 1 million euros can be prevented on a yearly basis. And so this is for adults there's an error in the slide. This is for adults, and for young people, it amounts to almost 700,000 euros and slightly more than 100,000 euros. So remember that this is for our members only, which is about 1/5 of the Belgian population. Actually, it's very representative of the Belgian population. So if we multiply it by 5, we can expect on a yearly basis that we can prevent about 45 million euros in terms of doctor visits alone. So there's a huge benefit to be gained if we would invest in lower air pollution, in better green space. So we have a whole lot of recommendations, and actually Mark mentioned already a lot of them. Of course, we are very in favor of the European Commission adhering to the WHO quality guidelines. You can see the 330-300 rule. It's a very easy rule, and we think that it should be applied. And as Mark has shown, it can be applied if there is political willingness. So there are a whole lot of recommendations there, and we stand by them, and we do everything we can in collaboration with partners such as HEAL to make them happen. So I'm looking forward to any potential questions after the third presentation, and many thanks for your attention.
Thank you very much, Luc, for this important presentation. Important in several ways in complementing what was said on the science initially, but also in showing the huge cost savings potential that we would have and we would gain from increasing green spaces in the urban areas. And that's not only a cost potential, but that also means if certain people have to visit the doctor less, that also gives can ensure that other people, especially vulnerable people, can go and see their doctor quicker, because we all know that nowadays there's also a lot of waiting time until you can see a doctor or also a specialist. So thanks for that, and also thanks for highlighting that the analysis that you have done can be replicated in other countries. This is certainly something that we would support as well in other health insurance funds digging into their data, into their wealth of data, and bringing forward this analysis. Indeed, we have another speaker, and then let's see that we have some time for an exchange as well. So very warm welcome to Marzena Cypryańska-Nezlek from, as I said, the University in Warsaw, and we look forward to your presentation on mental health and green spaces. The floor is yours.
Hello. I need to ask you for a moment, because it turned out that I have some problem with the renovation in my building. I'm really sorry for this strange situation.
Oh dear. Okay. So we'll wait a minute. Yes. Actually, while you that's okay. While you find a better space, let me ask a brief question to Mark then. Mark, if you're available.
Okay, great.
Since as I wanted to ask you from the evidence that you've shown, and you've done the ranking, you've done the analysis for Barcelona. When you present this to policymakers, especially to local decision makers, how open are they to this evidence on the health benefits? Is it something that they recognize? Is it something that they take up? Are there some city leaders we can highlight in Europe who are really putting forward this approach of the 330-300 rule?
Yeah, in particular, the 330-300 rule is quite popular in a way that, and now I need to open the door, because we see that's kind of attractive, and we've heard many other cities that actually would like to implement this. It's interesting, we had local elections here in May in Spain, and the Socialist Party put it in their program that they want to implement the 330-300 rule in all cities in Spain. Unfortunately, they didn't win many city councils, so there's still some work to be done. But in particular, the work that we're doing also here for Barcelona, for example, the Ejes Verdes, where we did the health impact assessment, the policymakers were very happy with it, and it provided them with more evidence to continue the work. You know, there's often a bit of skepticism around this kind of things from, is it going to work? What is it going to do? But actually showing these numbers, what are the potential, that was kind of powerful, and they really liked it for this. Always when I talk to policymakers about green space, they love green space. Not as much air pollution doesn't always seem to have the same kind of attraction as green space. Green space, yes, we would like to have more green space. But as you know, it's not always so easy because, you know, in many cities, there is not enough space to put a new green space. It really needs to have more drastic measures, reducing, say, road space and then putting in trees, for example, what is not always so popular with politicians. But we see that more and more cities want the green, and to have more evidence showing that it's good, it's great. The other aspect from it is, of course, that it's expensive. It's not something you can easily do, and even simple things like planting trees, most of the time, you know, 50% of the trees die within 2 years. So you need to have active management, you need to have replanting. So there's quite a lot involved in this, but the general reception is very positive. Putting it, you know, into practice is a bit more difficult, but I think many cities are trying.
Thank you very much. That's good, and that's very encouraging to hear that. Also for us as representatives of the civil society organizations, to hear that, yeah, many local decision makers are open to this, and actually that gives us also a reason and initiative to continue bringing that message forward. Marzena, let's now try with you again. Are you you're seated? I see. Okay, let's see how we can hear you well.
I
Yes.
just need to ask people to stop for a moment, and now it is fine.
Good.
So I'm ready.
The floor is
speak.
yours, please.
I've been told I can speak in Polish. Is it fine for you? I mean, actually, I thought about this in Polish. Okay,
yes, please go ahead. Yes.
Thank you. Now I need to shift. Okay. Marzena Cypryańska-Nezlek. Dzień dobry.
Good afternoon, and thank you very much for inviting me. I work at the SWPS University. I'm a head of Climate and Social Transformation Center. The main area of interest, climate-focused activities and research, mainly pertains to connections between environment, nature, and mental well-being. But this is a part of my activities. I focus on different consequences brought about negative climate changes and their impact on mental health. And climate-related threats are a part of a bigger whole. So a plethora of threats, difficulties, or challenges in relation to the environment. And today about greenery in Polish cities and the benefits related with green areas and their impact on mental well-being and health. My original intention was to relate to physical well-being, because hardly can we see mental well-being as a separate item. It's apparent that mental health is strongly associated with physical health, and there is a mutual impact. Therefore, I'd like to thank the 4 speakers presenting before me. I believe that they gave a wonderful introduction to the topic, so I can skip a number of physical health-related questions, and I shall focus on physical, mental well-being. A few years ago, next to my house, there used to be beautiful trees, sometimes perceived as weeds, because poplars are believed to be weeds. It is soft and brittle, we forget about air cleaning capacities. Poplars were to be cut away. I was petrified because greenery around me made me feel safe and more comfortable. It's natural reaction of people living in green areas. What happened? I was fighting for the trees. I requested research to show that these were the healthy trees that can carry on growing. There were no danger. I remember this situation. The tree falling company came and I had a short conversation with this gentleman who was a tree cutter. I tried to use human touch, saying, look, don't you feel better when you have the trees around? It's nicer, healthier. And he responded, yeah, but it's the city center. If you want greenery, go outside the city. A few years ago, this situation made me realize things that we all know. First and foremost, this gentleman, the tree faller, needed greenery. Little did he realize. And on top of that, these are the convictions about the city as abode, as the place to live in. I have a feeling that recently this non-functional attitude has changed. Not necessarily cities are perceived as places to live, rather than they are places to work. I used past tense. It's been changing. Cities are perceived as places treated instrumentally. We live here, we deliver objectives. And nature is instrumental too, not something that is beneficial for our health. So, there are two basic directions that we should pay attention to when speaking greenery in the cities and when designing different policies related to municipal space management. First and foremost, mental benefits that seem obvious, but in social awareness, not necessarily. And second of all, beliefs or convictions related to cities' functions. What kind of objectives are met there? So let me start with obvious objectives. When we speak about the relation mental health and nature's impact upon humans, normally we say about three basic levels related to human contact with nature. This is visual perception. You look outside the window or you look at images with nature. You are in the natural ambience and active participation, like walking, pastime, outside, physical exercise. What is obvious for all, I believe, because this can be perceived at the level of aesthetics, is the fact that greenery around us makes us feel better. A simple comparison, there is a grey street with no greenery, and then you compare the same street that has been the subject of greening. Most people say, I'd prefer to live in this green place. People feel better when immersed in greenery. They are more relaxed. Different research shows that well-being, mental well-being is associated with the amount of greenery in the place where you live. Normally, you take 1 to 3 kilometers radius located areas. It's about physical well-being, mental well-being. But the results show that natural ambience, greenery, makes you more relaxed, less angry or frustrated or rest, physical activity, different kind of exercise, reduces your stress level better, makes you feel relaxed. When you exercise in a park, compared to the exercise that is devoid of greenery or in enclosed spaces like a gym, well-being, how you feel, it's obvious, but there is yet another very important area of research, and I have a feeling that there's the most of these. The most often ones are the ones related to the fact when you are in green areas, vis-a-vis stress level. These are relates that you cannot doubt. So emotional states, reduction of stress. One of the research showed that in the areas, in districts where trees shadow 30% of the area, 30+%, the risk of mental stress development was much lower by 31% compared to the areas with less tree shadow. Speaking about the positive impact of nature on mental health, it is important to remember about concentration abilities. There is positive impact of nature and natural world impact on concentration, speed of decision-making process, ability to focus attention, to direct attention, to select information, reduction of mental tiredness, green areas presence, or when you just look at green areas outside of your window, this may have a positive impact on work satisfaction. This might be associated with the way you feel and stress reduction. It is important to have nature's impact on physical and mental development, emotional development of children. Benefits related to playing in the open area with trees, activities that play and games. This triggers creative thinking. You are more ready to take up challenges. Last but not least, a very important element on the list of benefits. These are social contact establishment. According to the research where you live, trigger being outside for elderly people. Research results have shown that the districts with less green areas have all elderly people who feel more lonely compared to the areas where there are relatively greater green areas. So these are the simple reasons that I mentioned before. So these areas naturally provoke to go outside, to go for a walk, to meet somebody outside, to strike up new friendships. I'm enumerating different dependencies. Question is why? Why should that be like this? One of the basic hypotheses is biophilic hypothesis, associated with the fact that humans are related to other species and nature. It's natural to be a part of nature. We are a part of nature. So we have natural tendency of being inside. On the other hand, in Anthropocene period that we speak about a lot, when humans' activity started to shape the ecosystem, humans started impact ecosystem. It's obvious to be detached from the nature. Nature is perceived to be a resource that serves specific purposes, and it comes at the cost of belonging and harmony. I pay attention to this. When we speak of environmental threats, it's especially visible when we talk about climate change. The planet, nature is next to it. We fight for nature, for the planet, forgetting about the fact that we fight for quality of life for ourselves. We are a part of this nature. So this separation of human and nature, let us look at the fact that hardly do we realize that what destroys nature, what exploits the cities, also exploits ourselves. If nature is believed to be an asset to be used, this is the way we are ourselves treated. So we are an asset. We have some higher objectives, and we forget about harmony that is so important in our being with nature.
Face now, and I do not know how much time I have. Should I finish right now?
Unfortunately, we've reached the end of our webinar and the end of the speaking time. But I think you made very good closing comments, which I would like to remind us all of. And thank you very much for reminding us that we're part of nature, and we should take a holistic approach, another approach that it's humans against nature, but that we need to find ways to live, as you said, in harmony. And we also clearly need to find ways to protect nature, our natural environments, and also to restore it. And I think that's a very important message for policymakers to hear, especially as they're looking into this new law, new regulations on nature protection.
And with that, add also one thing.
One thing, yes.
Yes, maybe I will say it in Polish. Myślę, że albo czasami apeluję też o to.
I think and I request that when we speak about the connection between nature and mental health or health in general, it is vital that such a shift in thinking where we understand that caring for the nature, demanding the nature, returning to harmony means claiming good life. We often ignore the fact that being in the nature, in green areas, contributes to the good quality of life. Sometimes we give up the quality of our life when we abandon the nature. And when we abandon the nature, we increase stress and lots of other issues for mental and physical health. So it's just for the fight for the sake of being in good life, good environment.
Closing words, and with that I would like to close this webinar and thank our three speakers for your enriching presentations and the wealth of information you've shared and the different perspectives you brought to the topic of the benefits of green spaces for health and mental health. As I said, the recording will be available on HEAL's YouTube channel, so don't hesitate for all of anyone participating here to share also the recording in your networks. Thank you to our speakers. Thank you to our participants. Thank you to the HEAL team helping to organize this exchange. And last but not least, thank you very much to our translators, without whom this event wouldn't be possible. And with that, I wish you all a very good afternoon. Thank you again for joining, and let's continue to bring forward this message on health and nature and green spaces. Have a good afternoon.